You and I are just going to talk here, Charlene. So, first of all, thanks for offering to do this testimonial today. You are a rock star, and I am super excited to share with our viewers here exactly what happened. But I think it's better if you share the program. Why did you originally pick up the phone call us? What was the chief complaint, your biggest concern when you called us?
Sciatica.
Sciatica. So you had that pain in the back. I remember you had really bad back pain in the buttock on the right side and down the right leg.
That's right.
Okay. And then we did an exam, and what else did we find?
Feet, neuropathy.
Yeah.
Neuropathy in my feet, which I didn't realize I had.
Mm-hmm. Yeah.
Because like I told you, I think when you're not used to having something wrong with you don't know about it, like people wear glasses, like I do.
Right.
I never knew I had problems with my eyes until I went to the eye doctor and put my glasses on. I could see again. I thought that was going to be I thought that was the way it's supposed to look because I didn't know no better.
Wow. And the thing is, with your feet, they were so numb, you didn't know it. If something's not really killing you, if it's not hurting, then you don't really think about it. So we just did the final exam, and I want to give you the numbers because this might blow you away, because with that neuropathy that wasn't really bothering you, you actually had, is it okay if I share?
Sure.
65% loss of those nerves in the feet on that right side, and you're now down to just 40% loss. So that's a huge track that we've gone. According to medicine, there's nothing that can be done for numbness, and we still have 40% loss of the nerves, but they are feeling a lot better. What I mean by that is not just feeling better for you, but you're able to feel things better, which is really important. But tell us about the sciatica, the lower back pain.
That was
how much better is that?
That's ungodly when I came here.
Yeah.
I would say it's 90% better.
What was it like? You said ungodly. What does that mean? Tell me, describe what that feels like, or what it felt like.
It was so bad that I couldn't sleep.
Mm-hmm.
And I get up and I want to go walking and I would almost fall. It hurt so bad. The radiating down my leg to the back of my knee.
Wow.
It was ungodly. And I'm not a person that can't take a lot of pain, because pain, it comes to everybody. But this was almost crippled me.
Wow, I don't know how you lived like that. And the medications helped you out a little bit?
It did. When I finally got the right one, the Neuropathy did it.
Mm-hmm.
But I used to take Neuropathy years ago for my MS. And because of the tingling and itching that I feel,
mm-hmm.
I'm not an itchy person. I can't stand that feeling.
Mm-hmm.
So I used to take that, and then I just didn't like the way it made me feel.
Yeah.
But that was the only thing that got me back until I came to see you.
And so 90% better. What does it feel like nowadays?
I don't hurt like I did.
Yeah.
Sometimes you get up in the morning, you have little twinges.
Yeah.
But nothing, like no hurting, no. When I walk, I don't feel like I'm going to fall. I can sleep now that I did not be able to sleep. I could not sleep before. It hurt so bad I couldn't get comfortable.
Whoa.
I'm sleeping good now.
Now, tell us the truth here. You're going to give it away. Of all the things that we recommended, which do you think were the biggest, most impactful things for reversing this neuropathy and this sciatica? What would you say?
I had another flare-up about 4 weeks ago.
Yeah.
And they started with that rebuilder.
Rebuilder, yeah.
And that they had a shock to me, like a little twinge thing on my back.
Yeah.
And I had that for the last 4 weeks, and I think that with all of your other help, all the exercises that Josh did for me, and all of the rebuilder on my feet, with the bath, with the tinge thing that they put in the water, I think I can't really pinpoint exactly what the best thing to tell you, other than that rebuilder that you put on the back for that nerve.
In your mind, that rebuilder was the biggest, most powerful thing for that sciatica.
Yeah.
There's another thing that I don't even know if you know how important this thing is, but tell us about the diet and how well you did on that.
Oh yeah, I've heard.
That's kind of like a therapy, but you didn't think about that.
Yeah, I didn't think about that. I'm down 44 pounds.
44 pounds
44
in how
pounds
long?
in 16 weeks as of Thursday.
Yeah. That's amazing.
And I I followed the paleo diet. Just about everything was said to do. I did it, and I used to do exercises. But my sciatic nerve got inflamed and aggravated me again, that I couldn't do the exercises, or I couldn't walk like I wanted to, because it flared up again. So all I did was the paleo diet, 44 pounds in 15 weeks.
Well, you guys listen to this. This is really important. So this is cute. This is key right here, because the word you used was inflamed. The paleo diet, and what we teach here, is that it's an anti-inflammatory diet. So one, it reduces inflammation around those nerves, around the sciatic nerve, the lower back, the arthritis, and all that stuff. So it's reducing inflammation. But two, and I gotta put a little disclaimer, not everybody will have similar results. Usually, Charlene, somebody will lose 10 to 15 pounds. Pretty common in 3-4 months. But you're down 44 pounds. Not only do you have less inflammation around the nerves, but you also have less weight that you have to haul around. And think about how much of an impact, or less of an impact, that's having on the discs, on the vertebrae, and of course on the sciatic nerve itself. So I know you were thinking therapy like rebuilder and either adjustment or all that stuff, but not to take away from the rebuilder and all the other stuff. It's awesome, but I got to hand it to you. You really did knock it out of the park with sticking to this paleo diet and really fixing yourself. So
I enjoyed it. And you didn't get hungry. You didn't get hungry as long as you went by what the recipes you all gave me, and you went by those recipes, and you had, I think it's a mind over matter thing. And you really follow what you're supposed to do. And my knees were bothering me too. And didn't know that until you did your testing. And I don't feel much pain in my knees at all.
I want to swing around to this side and just say congratulations, because you're awesome.
Thank you.
She's awesome. The one thing that we mentioned too, I just got to note, is mind over matter, is what you said. And you're saying a lot of key things right here, because what's really interesting, and maybe we call it placebo, I don't know, whatever, but somehow you got in your mind, maybe it was Jessica saying weight loss or whatever, and maybe Jessica, somehow you got in your mind that I'm supposed to lose a half a pound to a pound a day. That's exactly what you did, but you weren't actually on my weight loss program. She was only on the anti-inflammatory diet. We usually use 10 to 15, so I'm glad we didn't say you should expect to lose 10 to 15. Because you probably wouldn't be down 44 pounds. So mind and having that belief that your body can and will heal itself is important as well. So, well.
I recommend anybody to come see you. Anybody.
Yeah, I appreciate that.
And I'm not saying just give you business. I'm telling you because it works.
Yeah.
What you did for me worked.
And so if you hear that, it's also on the other side, you have to work it too. So I wish it's as easy as, just come on in here and you're just going to automatically get better. The reality is it's teamwork. And you deserve as much credit as we do, because we all worked hard and you worked hard as well. So
you all do. You deserve the credit, because you're the one that got me to do this, and then I followed what I was supposed to follow. And of course, some people can't do what I did, but I encourage anybody to look into this thing and really follow it. For the first 30 days, you have to follow it to a T.
I agree.
And after that, you might be where you want to be, but you can keep on going like I did.
You're awesome.
Thank you.
Thank you
Appreciate
so
it.
much. You've been incredible, and hopefully an inspiration to many other people on this here video. All right. Thanks again so much.